Foreword by Gary Gordon, MD. For years I have highly prized Dr. Tom Levy's significant scientific contributions regarding the miraculous healing powers of vitamin C. I have heavily relied upon and referenced his previous book, Curing the Incurable, Vitamin C, Infectious Diseases and Toxins, for many years in treating patients and teaching practitioners all over the world. Through the extensive published literature compiled by Dr. Levy with over 1,200 scientific references, many now know which forms and in what dosages vitamin C is most beneficial, proving that the accepted daily requirements of vitamin C are far too low for maintaining healthy cellular function and fighting off infections. Vitamin C in what appears to be megadoses of 5,000 to 20,000 milligrams or more orally and 20 to 200 grams intravenously can and has saved lives even after all else has failed. This book comes at a time when our healthcare system is failing. We are losing our personal rights to choose the type of medical care we want. We are losing availability to quality hospitals and services, and we are losing doctors as they close down their practices because of oppressive governmental restrictions and legislation. Corruption is authority plus monopoly minus transparency. This anonymous quote describes the current functioning of our corporate-controlled government today. We must not sit idly by thinking that the Obama health care bill, unconstitutionally forced into law against the people's will, is going to make things better. If it is not repealed, we will only experience more of the same and worse. Currently, we spend more on health care in this country than any other country in the world, yet we are getting fatter and sicker while taking more and more pharmaceutical drugs. Deadly drugs are mass-marketed by corporations making trillions of dollars off sickness and suffering. Prescriptions are pushed and peddled through slick, happy commercials targeting every demographic, from infants to the elderly, and even the unborn. How can one deny the legitimacy of a drug commercial showing a smiling and relaxed person strolling along a beautiful beach at sunset or enjoying a family gathering with loved ones, now happy and healthy because their diagnosis of depression or heart disease, or cancer, or high cholesterol, or erectile dysfunction has finally been cured with the newest wonder drug. These commercials also urge you to ask your doctor about said drug if you suspect you might have any of the symptoms or conditions described. And don't pay any attention to the dozens of ill effects listed quickly and quietly as a disclaimer at the end. If your trusted physician believes in it, and it is approved by the FDA, then it must be the safest and the best course of treatment, right? Wrong. It's all about money and control. Most drugs only mask symptoms, ignoring the real underlying causes of disease, while all the while generating new illnesses and conditions that will require another drug. The drug companies know this and knowingly hide it from you. Sadly, the Wall Street Journal reports that more than a quarter of U.S. kids and teens today are taking a prescription medication on a chronic basis, with nearly 7% of those on 2 or more drugs. Flu vaccines and antidepressants are being prescribed to pregnant women with known adverse effects upon the fetus, resulting in long-term chronic conditions for the child later in life. According to the CDC, half of all Americans take prescription drugs on a consistent basis. Approximately 1/3 use 2 or more pharmaceutical drugs daily, and more than 10% of all Americans are frequently on 5 or more drugs at a time. In light of those statistics, it should come as no surprise that the Journal of the American Medical Association, JAMA, has reported that fatal adverse drug reactions, FADRs, are now the leading cause of death in the U.S. today. That's FADRs, F-A-D-R. The unsavory relationship between government-controlled mainstream medicine and the pharmaceutical industry has been uncovered by none other than Harvard Medical School's Dr. Marcia Angell, who is also the former editor-in-chief at the New England Journal of Medicine, one of the most respected medical journals on earth. An outspoken critic of the current U.S. healthcare system and the pharmaceutical industry, Dr. Angell is the author of the book, The Truth About the Drug Companies, How They Deceive Us and What to Do About It, and an excellent article in the New York Review of Books called Drug Companies and Doctors, A Story of Corruption. Revealing the financially driven corrupt ties between current healthcare practices in the U.S. and industry-backed clinical research, she wrote, quote, "No one knows the total amount provided by drug companies to physicians, but I estimate from the annual reports of the top 9 U.S.-based drug companies that it comes to tens of billions of dollars a year in North America alone. By such means, the pharmaceutical industry has gained enormous control over how doctors evaluate and use its own products. Its extensive ties to physicians, particularly senior faculty at prestigious medical schools, affect the results of research, the way medicine is practiced, and even the definition of what constitutes a disease." End quote. Mainstream medicine and the media, under the control of the FDA and their pharmaceutical company clients, have done everything in their power to keep things like vitamin C and other natural, affordable forms of self-treatment from being routinely used as the first line of response to any health issue we encounter. Why do they do this? Because nutritional supplements are not patentable, and so they aren't able to make trillions of dollars through proprietary ownership like they do with pharmaceutical drugs. That does not mean they aren't continually trying to find a way to control our healthcare options, pursuing control through propaganda, misinformation, and furtive legislation, all in the name of public safety. In July of 2011, the FDA and Illinois Senator Dick Durbin, Democrat, introduced yet another bill, the Dietary Supplement Labeling Act of 2011, S. 1310, specifically designed to suffocate the nutritional supplement industry through ridiculous labeling and redundant notification requirements. They do not want the public to know the unbelievable power that high doses of oral and intravenous vitamin C, taken orally in daily doses of 4 to 20 or more grams a day, and when needed, intravenously, in doses of 30 to 200 or more grams a day, provide to help mankind deal with some of our most challenging chronic and acute health problems. We must all learn what we can do to help ourselves deal with the myriad of healthcare and problems we encounter, from minor accidents to the antibiotic-resistant infections that kill over 100,000 each year.